heard about the fact that when you write things down, that they become real. So that is something that I practiced by way of an assignment. So back in 2009, Dr. Tyson, I can't remember the class, but it was a class that we had an assignment to create a dream board for ourselves. This was a 2009 class. I started my HIM career in 2008. So I applied at HCC in 2008, and then I graduated in 2010. So 2009, Dr. Tyson gave us an assignment to create a dream board for ourselves. This dream board is what I created back in 2009. You can see from the graphics, PowerPoint way back then is a lot more improved now, but this was what I created in my PowerPoint slide back then. I can say that everything that I put on this list, except one, has happened. And so I think that that really speaks to the power of writing things down. Create a dream board, write it in a note, in a journal, whatever it is that you want to do, or whatever future that you see for yourselves, to just kind of write it down. So this dream board started in 2009, and so I'm going to go on to the next slide. Again, that's pretty much what Dr. Tyson talked about, so I really welcome questions. I want this to be interactive. I'm going to go through my career journey. As I stated earlier, started in 2010. I graduated from HCC in 2010. So when I graduated, I have to say I know Dr. Tyson has called me one of her favorite HIM professionals, but I have to say that she is a complete inspiration to me. You just never know what how much inspired I was by my 2 years of learning from you. And so I just wanted to take this opportunity to say thank you while we're on the call here, but also to just let everyone know, let the students know that while I was in the program, even though I created a dream board for myself, the journey that I've taken to get to where I am today has not been straight, right? So I got my RHIT, I finished my associate's degree in 2010, and I went ahead and took my certification for RHIT in 2011. I say that to say that I tried not to wait too long from after I graduated from get my associate's degree to study and take the exam for RHIT, because I know that some students sometimes, we graduate and it takes us a while to maybe study for the exam. But one of the advice that we got from Dr. Tyson and Ms. Doria back then was that try to study for your certification exam for your RHIT as soon as you are done with your studies, so that everything is still fresh, everything is still, you still have the memory of everything that you studied, and then you can just go ahead and take that exam and you pass it. So that's what I tried to do. I had some financial difficulties, so I couldn't take it right there in 2010, but I was able to take it in 2011, and I passed. I used my HEMA study guide. I used whatever textbooks that we had back then. Those were some of the materials that I used to study for that exam, and I was able to pass it. So that would be something to note here about graduating and trying to take your exam as soon as possible. So once I took my RHIT exam in 2011, it took me about, I would say, maybe 8 months to find a job within the HIM field. So, almost a year I was trying to apply to positions just within the healthcare. I applied for HIM tech positions. I applied for just really anything that was related to HIM. So, and if you think about it, back in 2011, this was right at the beginning of, I guess, EHRs and medical records going electronic. So we didn't have that experience at the time to start coding electronically. So, well, not to start coding, but to take my exam, we actually had to use our coding books to go through the coding exams. But anyways, in 2012, I believe that I attended the Texima conference in Galveston, and it was while at that Texima conference in Galveston that I met the director, maybe it was the manager of coding at Harris Health System at the time. Talked about it with him and introduced myself, and I went there with a classmate of mine. So we talked to him, we introduced ourselves, told him that we had just graduated from HCC and we were looking for a job, and he mentioned to us that Harris County, at the time they were called Harris County, that they had a put-in apprentice program going on. And so that's really what kickstarted my career in the put-in field. So 2010, I got a put-in apprentice position at Harris Health, and I started working as an outpatient coder. It took me about maybe 3 months or so, maybe 6 months. When I started working as an outpatient coder, I got promoted to start working as a charge specialist. So working as an outpatient, I was coding clinic records. So, patient goes to the clinic, those were the kind of charts that I was coding. But afterwards, I went up to my manager and I said, hey, I need to do a little bit more. I didn't want to continue coding clinic charts. And so I went up to them and said, hey, can you give me more? So they gave me the chance to start coding ER records. So I worked for Harris Health coding ER records. And then after a while, maybe a couple of months, I was like, hey, I need more. I needed more challenges while I was working as a coder, and so they gave me the position to start working as a charge specialist. So just within the 1 year that I worked with Harris Health, I was able to start coding clinic records, started coding emergency records, and then eventually I started working as a charge specialist. So that basically kick-started, it kind of got me rooted in the coding field. I know that most times that students, when we graduate, we hear about coders making a lot of money, and they do, but sometimes it can be hard to get and break into the field. And so I would say that a lot of organizations, from the last time that I looked into it, they do offer coding apprentice programs. And so if you're looking to break into the field, that would probably be one of the ways that you can do it. And then while I was at Harris Health, the management at the time gave the employees a challenge to take your CCS certification. So if you wanted to work as an inpatient coder, you had to have your CCS certification. And so they gave the inpatient coders a challenge. Take your CCS by this time, and then we can consider you for the promotion. Well, I wasn't an inpatient coder at the time. I don't even think that I had the desire to be a inpatient coder, but I went ahead and joined the challenge. So while working as an outpatient coder, I went ahead and studied for the CCS exam, which was very hard, being that I was not working as an inpatient coder at the time. But I did end up studying very hard. And then I passed. I passed and I got my CCS certification. So here I am working in emergency records. I have my CCS certification. I have my HIT. And I was wondering, well, there's got to be more to HIM, right, than just maybe working in the traditional HIM field and coding and charge specialist, doing some billing work, doing charge specialist work. And so I started looking for what else was out there. Now, if you remember from my previous slide, I actually did want to code. So I had on here, I had the dream to be a coder, but I also had the dream to work in like a health information exchange and also do consultant. And so when I started thinking about what else I could do, believe it or not, I did go back and I did look at that dream board. I was like, okay, well, you did say you wanted to work in consulting. You can start looking into those kind of positions. And I also love to travel. We all love to travel for vacations, right? So I started looking. Was there a question?
Yes, ma'am. Yes, Miss Amona. I would like to ask a question. Dr. Butts actually asked, can you talk about the transition to charge specialist?
Yes, yes. I can talk about that. So that transition. So working as a coder, you are the kind of work that we do is a patient comes into the hospital. I was an emergency coder, so they come to the ER. The doctor sees them. Maybe they do they got a cut, and so you have to code the fact that they performed like a wound repair or laceration repair. Um, if while they were at the emergency room, they received maybe like an injection, or maybe they were under, if a patient comes to the ER and they're not well enough to be admitted to the inpatient unit, but not well enough to be sent home, if they're not sick enough to be admitted and not well enough to be sent home and they put them under observation, then there's some charges that would be put on that patient's record and into their billing record. And so my transition to a charge specialist, the kind of work that I was doing was I would work the ER charts, I would code them, so I would put diagnosis codes on them. But then I would also get the ability to look at the charges on that patient's chart and make sure that those charges are accurate and that the whatever procedures that was done on that patient while they're at the hospital would be paid by the insurance, right? So well, insurance companies need to know that the charges that are being billed to them, there was a need for it. So you can't order a chest x-ray for a patient that came in with a wound on their leg. So those are the kind of charges that I'll be looking at. And as a charge specialist, I want to make sure that the charges on patient structure are accurate, they're necessary, and that there's also documentation to support those charges. So those were the kind of charges that I did. And then in different states, there are different rules, so to speak. You have LCD edits, you have NCD edits, local edits, you have national edits. So you kind of have to know the different edits that would hit the patient's chart and know how to actually rectify those edits. So you can't send a patient's charge to billing if all of those charges have not been reconciled. Or sometimes if the patient's charge gets out the door, billing will send it back and say, hey, there's some codes on here, there's some charges on here that are not accurate. The insurance company has returned it, they've denied it, and then you as a charge specialist have to go in and look and review what the issues are. So that's kind of like the high level summary of what I did as a charge specialist. So my work was not just putting codes on the record, but I was also reviewing the charges to make sure that it's accurate.
Thank you very much.
Yes, thank you. All right, so then I while I was working as the charge specialist, working as a coder, I actually also went ahead and took a part-time job working as a coder for another organization. And as I mentioned earlier, I started thinking to myself and saying, well, is there more that I can do? I did want to veer away from the HIM space, but I also wanted to work as a consultant. And so when I applied to this position at Siemens as an implementation consultant, I was actually working on clinical implementations. So my work as an implementation consultant really, I was able to, because of all of the knowledge that I got while I was at HCC and with my RHIT, we learn about healthcare delivery systems. We learn about the legal aspects of the healthcare about the healthcare system. We learn about we learn about meaningful use. We learn about statistics, how to gather data and how to look at data. We learn how to code records. So when I applied for this position and I got the position as a clinical implementation consultant, the work that I was doing was basically going to different hospitals and I was helping them to develop provider documentation. So when you think about the EHR, when the doctor is seeing you, they're typing stuff into the EHR. They're typing your history, your chip complaint. So you go in and you say, "Well, my neck hurts." The doctor would document it. Or let's say my arm hurts, and the doctor is asking you, "Well, is it the left arm or the right arm?" And you tell them it's the right arm, and the doctor would ask you, "Well, do you feel pain?" All of the documentation that the provider is putting into the EHR, the fields that they're selecting, myself and my team and the people that I work with, we were the ones that went into the EHR and designed it to the way that the doctor wanted to see it on the screen. So, when you see an EHR, all of the fields that the doctor sees in front of them to be able to select that you have pain, to be able to select that your right arm hurts, all of those different fields, and for them to be able to select medication on the screen and say that you need to take 50 milligrams of whatever medication that they're prescribing, all of those fields have to be built and designed by a team. And so that was some of the work that I was doing. And in that work, we have to do what is called system requirements. So we go in and we're asking the doctor to say, "Hey, what do you want to see in the system? What are some of the things that are required for you to do your job?" So you want to be able to select a diagnosis code. How do you want to select it? Do you want to see it as a drop down or do you want to see it as, a click one? So all of those different things, we call those things system requirements. And so we built that, we designed the system, and then once we design it, we take it back to the doctor and we say, "Hey, this is what we've designed for you. Does it look right?" And then the doctor would go in and they would validate it. Once they validate that everything that we've designed for them looked accurate, then we have to test it. So we have to come up with a scenario where it's not real life, but we have to act like it's real life so that when a doctor goes in and they are wanting to do their job, then they're able to actually perform their job in the proper manner, and that there is no patient care issues. So if a doctor is not able to document their allergies in the system because maybe we didn't put an option for them to document an allergy, that can cause patient care issues, right? So all of those system requirements, design, testing, and validating, those are the kind of work that I did as an implementation consultant. And it was very exciting work. You have to be knowledgeable about the healthcare field, but then when you start working for a company, they will provide tools for you to learn. I think the key thing for me was that I was always very curious. I was always looking into things and trying to learn things and asking questions of my coworkers and my managers and my colleagues. And so the work that I did as an implementation consultant was very rewarding. And I during that time is when I also started working or trying. I went back to school to get my bachelor's degree
Oh
in
my God.
HIM. So I was working, traveling I think I traveled out of the every single week out of the month, except the month of December. And I would travel from Monday through Thursday and come back home to Houston on Fridays. And then Sunday night or Monday morning, I'm back on the road, traveling to my different clients to help them to do the work that I just described. While doing that, I was studying for my VSC. Thankfully, I enrolled in an online program, and so that afforded me the ability to be able to do that. And it was during this time in 2014 that I graduated with my bachelor's. And I also took the opportunity to study for my RHIA certification, and thankfully I passed that as well. So it was not enough that I was working in a field that I really wanted to. I maybe could have just stopped right there, but I wanted to make sure that I kept on the journey that I dreamt for myself. And so um, once that was done, I actually then transitioned to a different company. So Cerner is a vendor of EHR. So when you hear about EHR vendors, you maybe hear about Epic, you hear about Cerner, you hear about eClinical Works, all these different EHR vendors. Cerner is one of them. And for Cerner, I started to work as a revenue cycle consultant. So in revenue cycle, what I was doing at Siemens was more clinical with providers, but with revenue cycle, I went back to my roots. So I was working, doing some HIM implementation. So in HIM, we're all about the medical record. We know privacy, we know security, we know compliance. We need to make sure that the patient's record is safe, it's secure, there's no breach to the record, and we also need to make sure that the patient's record is timely, and that it has integrity, so that there's nothing that is inside the patient's record that is not supposed to be there. So the kind of work that I did as a revenue cycle consultant was that I was I was designing systems to where if a physician has not completed a patient's notes within a certain time, they will get assigned what we call deficiencies. And these deficiencies will, you have a time period, you have maybe 30 days to be able to complete these deficiencies. If they're not completed, you get sent to the medical office, medical staff office, and within a specific time period, if the doctor does not complete their charts, they will be up for suspension. So um, those are the kind of systems that I developed for the organization. So I developed deficiency tracking. I also developed systems for clinical reporting. So we know that in HIM, we are the custodians of the patient chart. Um, we're custodians of it, but there also needs to be a way to report out the information, whether for research purposes, whether to the Office of Statistics, or if the Office of Statistics is asking for how many patients in 2017 did you admit that maybe had diabetes. So that would be some of the work that I do. I'll be able to create a report for the staff, for whoever is asking for it, to be able to produce that record. If when we talk about COVID, right? Nowadays, when you hear about the COVID numbers, they are getting those numbers from certain reports that are being run by the organization. And so those were the kind of things, work that I was doing, is that I was setting up those reports. I was looking in the system, gathering the data, putting in some queries in the system, so that whenever you go to pull those records, you'd be able to get some accurate data out of it. So I went back to my HIM roots, did deficiency, did ICD-10 work. So um, if you know about clinical coding, you know that you would set up 3M, for example, or Optum that you use for coding. I would help the organization to set that up as well. And I was able to tap into my knowledge as an HIM and RHIT specialist, CCS. I also had coded before, so I was able to apply that knowledge to the work that I did. And it was right around that time in 2017 that I became an adjunct at HCC. Um, and throughout this time, I was also still traveling. So after traveling for about 5 years, I kind of got tired of traveling, and so I got a position, a remote position, working as an application consultant. I was really doing a lot of the same thing that I was doing for my previous organization, but this time I was working for one hospital. When I was working at Cerner, I worked for different hospitals, but this time I worked for one hospital. And in that time, I was able to really hone my technical skills, and those technical skills allowed me to kind of go up in my career trajectory. Sorry about that. I started as a consultant, and then I went up as an architect. And it was during this time in 2008 that I also got my master's degree in healthcare informatics. So I definitely kept my foot on the gas. I didn't stop, even though I was working. I had all this, experience. I just kept going, and so I did get my master's degree in healthcare informatics in 2018, and then by 2021, I was promoted to be a team lead. Team lead, basically, what I did was now I was performing in a project management role. So any projects that we had related to HIM, whether it was Enterprise Master Patient Index, so your EMPI, whether it was deficiencies, release of information, coding, any project that was related to HIM, I would be the team lead over this project. So that's what happened in 2021. And then Miss Dr. Tyson mentioned that the position that I just currently started now in January, working as a senior consultant at Deloitte, um, allows me to bring all of the knowledge and the skills that I've learned over the years. Just talking about my journey now, starting as a coding apprentice at Harry Salt System, getting my certification, going back to school to get my master's, my bachelor's, and then my master's. My work at Deloitte now allows me to bring all of those skills and knowledge together to actually now act as a subject matter expert. So they look to me, my clients now will look to me to basically know what I'm talking about when we start talking about healthcare, IT, or talk about EHRs and implementation and project management and coding. All of those topics now, my clients will look to me to help them to improve their processes. Um, EHRs have been implemented over the years. Now, a lot of organizations are looking for ways to improve their processes. They're looking for ways to optimize their systems, to improve performance, and they're looking for ways to really improve the way that care is being delivered to patients. So, those are some of the work that I'm going to be doing now. And now, hospitals are looking to move to the cloud. So they're looking to move a lot of their infrastructure from within their organization to the internet. So that is that is some of the initiatives that I'm going to start working on for my clients. So that's really where I'm at now in my career journey. It's been very interesting. Um, I was not a traditional student when I was getting my bachelor's. Obviously, I got my RHIT degree first. I didn't go on campus or anything. My journey was not as straight as the typical one, but I can say that it has been very, very rewarding. The HIM field in general is so vast. You can pretty much be anything you want to be within the with your HIM degree. So definitely stay on course, keep your foot on the gas, and this is my journey so far, and I'm not stopping. When I was getting my master's degree, my head of department was encouraging me to get my PhD. I'm not sure about that, but we'll see.
Hello, hi, this is Deborah Butts. Can I ask a question at this point? I know we got some other questions, but I want to ask one.
Yes, ma'am, and I'm all done with my presentation. So
Oh, Thank you so much. Oh my God, what a fantastic journey. I'm just sitting here just in awe. Congratulations on this fantastic journey from 2010 to 2022. So awesome. I had a quick question. I wanted to know, going back to, okay, so 2012 and 2013, I know that's kind of where everything got started. Starting out in coding, charge capture, getting the CCS. But then in 2014, when you went to Simmons and you started being an implementation consultant, my question is, because I noticed you really didn't get the hands-on, I mean, the academic training in informatics until 2018 when you was over at, you got your master's from UT Health. So just to help me and maybe it might help some of the students, what was the level of training at Simmons that you got in 2014? Because it sounds like to me, and correct me if I'm wrong, it sounds like to me that Simmons is really what propelled you to really get started in the implementation IT EHR piece. So what level of training did you get at Simmons? I know you said what's when you got there. Sure, you brought your coding, you brought your certificate, you brought your RHIT, but how much training did you get at Simmons that propel you to really start to drill down in this process?
Sure, yes. So that implementation consultant role was an entry level position, and
Okay.
as entry level, they put us through a boot camp, so to speak. So I believe it was a 5 weeks boot camp to
Mm-hmm.
learn not just the healthcare industry in general, but to learn how to be a consultant. So we went through that boot camp. I think I was in a group of maybe 22 of us
Mm-hmm.
that were hired at the same time. And so they put us through a boot camp. We learned, I was really trained to learn the healthcare industry all over again. Now,
Okay.
it allowed me to, I was able to grasp a lot of the information because of my previous knowledge, but
Mm-hmm.
they did put us through a boot camp to learn about the healthcare industry and really teach us how to consult and how to also think when you're working within the system. So they put us through system training, gave us exams throughout the time. So you do a module and you take an exam and you pass it and then you move on to the next one. So they do train you on their system and they also train you on how to be a consultant.
Okay. And this was all wrapped around EHR implementation, correct?
Yes,
Okay,
yes.
okay. So that's why I wanted to ask that question because I think a lot of times I'm so happy that you're talking about this because I think it really paints a picture to the students of how they can transition and grow. Once you get that first job and you use that information and for those who want to progress. I mean, everybody may not necessarily want to. Everybody's path is different, but I love your journey because it basically shows you how every piece of your education um, piggyback on another piece and continue to propel you, in your journey. And I was just so curious about the 2014 because it seemed like to me that's where everything really kicked off was in Simmons. And when you start to get your drill down and hands on in EHR implementation, and from there, the sky's the limit. and you really started to progress. So thank you so much for that explanation. It makes sense to me now, and it helps me. And I hope it helps the students as well.
Thank you, Dr. Box.
You're welcome. Thank you.
Okay, so we have another question. Whoops. Okay, sorry, I have to scroll back up. Would you mind stop sharing your screen?
Yes, yes. Let me do that.
Thank you so much. Okay, now I can see that. I apologize. I couldn't see the question anymore. What are the best steps to get into implementation consulting?
Yeah, so I think as far as the best steps really, obviously get your education, take your certification always. I think the best way to put it is if you go through a degree that requires you to take a certification. If you don't, that's really like you're just leaving money on the table because that certification really shows your employer that you're serious about the field that you're in. So I would say, get your degree, get your certification, and really read up on the different ways that you can be a consultant. So, when I would apply for the positions, I would first read the job descriptions. So what I was doing was I was reading the job descriptions, and then I was trying to pick out words in there that, the kind of requirements that they needed you to be. And then the best step really is to practice how to sell your knowledge. So